Ontario is a population base of about 13 million people, and in the mid-1990s, the government was spending about 22% more than it was taking in. So we had an operating deficit of about 10 billion, and that formed the burning platform for change that was taken up by a newly elected Conservative government in 1995.
And what did this mean for the health budget?
What it meant for the health budget was that it would be constrained at its level when the Conservative government was elected. So their view was the expenditures in health would remain the same, but the way in which that money was spent had to change. So in the previous 5 or so years, the hospital sector in particular had undergone tremendous change as a consequence of new technologies and so on. We had reduced the number of beds by 8,000 to 10,000 in Ontario, significant decrease, but no physical capacity had been closed, and that would have allowed for consolidation of physical plant. So the government saw an opportunity to not only consolidate physical plant, but to make the infrastructure better and to reinvest healthcare resources in other elements of the healthcare system.
So a considerable challenge for health.
Right.
What approach did the government in Ontario take to this?
Right. The government decided to establish an arm's length commission with the authority to close, consolidate capacity, or make other decisions with respect to the hospital sector of the health system. It also was given the responsibility to provide advice to the government about other elements of the healthcare system as well. What would changes in the hospital sector mean for home care and community care and so forth. But the fundamental authority that the government delegated to the Restructuring Commission was to make binding decisions. And that delegation was tested in the courts and survived court tests. So when we looked at it and we tried to find examples of what other jurisdictions might have done in similar circumstances, and we couldn't find a Western democracy that had delegated such authority to an organization at arm's length from government to make such decisions. But while that organization was created, government still was accountable at the end of the day for the decisions the Restructuring Commission made, and had to account to the electorate 3 to 4 years later about those decisions, and was reelected.
But nevertheless, you, as head of that commission, had to set about making some pretty tough decisions. What approach did you take to this, particularly about getting legitimacy for what you were doing?
Right. Well, the process was very important, and it was important so that people understood that we paid attention to local circumstances. So where planning studies had been undertaken in certain communities, we used those studies as the starting point for our work. And we went and met with the leadership, community leadership, healthcare leadership in those communities to understand their perspectives. Then we created a report that outlined what we thought would be the directions that ought to be taken, and gave the communities 30 days to tell us whether we've got it right or wrong, and we then assessed that feedback and amended our final directions as appropriate. And while we're going through this process, we're continuing to communicate through the media to the public, whether through editorial boards, through news reports, and so forth, because we felt that it was very important for the community to understand as clearly as possible what the vision was, what the purpose was, and this wasn't only to deal with the financial circumstances of the province, but more importantly, it was to create a better health system.
Was the media and the public behind them, were they hostile to this, or were you able to try to actually persuade people that there was a purpose to some of this?
Well, we were able to persuade people that there was a purpose, but we didn't have people marching in the streets in support of what we were doing. These are very tough public policy considerations and questions, and people are concerned, and they will likely reserve judgment until years after implementation to really determine whether or not they agreed with the decision taken. So we had support, but I wouldn't call it overwhelming support because these were very difficult. But what it proved was that you could make change in an element of society that politicians often tried to stay away from because they were worried that it was the equivalent of the political third rail. You know, if you touch it, you won't get elected.
So in the end, how many hospitals were closed, merged, changed?
Right. When we started, there were approximately 225 separate hospital corporations in Ontario, and by the finish of our mandate, our term, we were at 150 separate hospital corporations. We had directed the closure of approximately 30 hospitals, all of which have been implemented. And the consequence is that we've shifted the mindset of healthcare leaders from perspectives of autonomy to interdependence, that we really do need to behave more as a system as opposed to separate organizations that have only the interests of that organization at heart.
You've been here for a few days listening to the challenge that faces the NHS in England, which is meeting an immediate financial challenge and also trying to reform the system to make it sustainable in the long term. Based on your experience, what observations do you have about what politicians, healthcare leaders and the media ought to be thinking about now?
Well, it's somewhat difficult after 2 days to come up with anything that would be clearly thought through, but on the face of what I've heard, I would suggest that some consideration be given to clarity of purpose, to really describe what the end game is for these changes. What is it that we're trying to achieve? If it's only about the money, the provider, community, citizens will never buy in. But if it's about a better future, of course they will. But they need to understand what that better future is. And what we've heard a lot about is structural change, but what we haven't heard clearly is to what end. So we've had a discussion about the means, but not the end.
Looking back on the process, I mean, it could be argued that the politicians in your case had tried to get themselves out of blame or responsibility for this. Do you feel that you, in a sense, as a commission, you took the rap for this, or did the politicians kind of share in this responsibility, even though they'd put this at arm's length?
Well, we certainly received our share of criticism throughout this process, but it was clear that the politicians wore the decisions that we made. And the Premier would stand up in the legislature and say, we've delegated this authority to this group. We have confidence in the membership of this group to make appropriate decisions in the public interest, and make no mistake about it. When we go to the electorate in 4 years, we will be held to account for the decisions of that group.
And what happened in the end? Did the public punish them for having done this?
They were re-elected with a majority government 4 years later.